a nerve is a collection of many neurons. So when an action potential is generated in a neuron, it travels along the length of the axon and reaches to its terminal. Now, if the target organ for the nerve is a skeletal muscle, the neurotransmitters which are released from the nerve terminal act on the skeletal muscle. There is generation of action potential in the skeletal muscle fiber, and it ultimately leads to contraction. So this is fundamental for understanding the motor nerve conduction velocity and sensory nerve conduction velocity. So when we are recording for the motor nerve conduction velocity, we stimulate the nerve. Okay, so nerve is having many neurons, but we have to make sure that all the neurons in this nerve are stimulated. Okay, so this action potential in all the neurons travels along the axon, reaches the skeletal muscle, and there is action potential in the skeletal muscle. Now, for recording motor nerve conduction velocity, we stimulate and then we record from the skeletal muscle its action potential. Okay. While in sensory nerve conduction velocity, there is no muscle, right? Sensory nerve supplies a receptor. Basically, it is an afferent from the receptor. So, we stimulate somewhere middle in the sensory nerve. We stimulate at a particular landmark, and there is generation of the action potential in the sensory nerve as well. Now, this action potential travels either to the dorsal root ganglion and to the dorsal horn of the spinal cord. It is there the afferent is going. Okay, so this is known as orthodromic conduction. And this action potential also travels towards the receptor. Okay, so this is known as antidromic conduction. Okay, see, you have stimulated in between the nerve. There is no prior action potential, say suppose, and we have stimulated in between. So here also the nerve is polarized. Okay, it is at RMP. It is not refractory. Here also it is at RMP. So this action potential which has generated, it can travel in both the direction. So when we talk about action potential generation and conduction in normal human body, we talk about only orthodromic conduction, because behind area we say it is refractory. But when we are recording, we see that it travels in both direction, because it is the first action potential. The nearby areas are not refractory. Okay. So in sensory nerve conduction velocity, we stimulate with this action potential which is generated, it travels, and we record the action potential directly. Okay, so this is the fundamental. Now moving on to the details of motor nerve conduction velocity. So in motor nerve conduction velocity, I told we have to record from the muscle. We have to stimulate the nerve and we have to record from the muscle. Now this nerve has many alpha motor neurons. Okay, it's a collection of neurons. Nerve is a collection of the neurons, and it can have both motor as well as sensory fibers. It has both motor and sensory fibers. Some are coming from the spinal cord, some are going towards the spinal cord. So here we are bothered about the motor nerve fibers. Okay, so here this nerve is showing lot of motor nerve fibers. Now one alpha motor neuron which is coming from the spinal cord supplies some fibers within the skeletal muscle. So you see this black neuron, I have made with color distinction. Here it is supplying the black fibers in the muscle. Okay, so the number of muscle fibers which are supplied by a single alpha motor neuron, that is known as a motor unit. Okay, so whenever a particular alpha motor neuron is stimulated, all the muscle fibers which are supplied by that particular motor neuron all will be stimulated, and we record that action potential, and that is known as motor unit potential. Right? Now, for motor nerve conduction velocity, we have to make sure that all of these nerve fibers, all of the motor nerve fibers are stimulated. Okay. So it is not that particular motor unit is stimulated and you record. No, we have to make sure that all of the motor units are stimulated. And how to make sure? We keep on stimulating the nerve. Okay, we stimulate with a particular strength of the stimulus, and we record the motor unit potential. Then we increase the size of the strength of the stimulus. We increase the strength of the stimulus. That means we increase the voltage. Now With that, the other motor fibers will also be stimulated. So there are low threshold fibers, there are high threshold fibers. Low threshold fibers are those which are stimulated with lesser strength of stimulus. High threshold fibers are those which are stimulated with little higher strength of stimulus. So we keep on increasing the strength of the stimulus and we keep on recording MUP. What will happen if more nerve fibers are recruited? More MUP will be generated and this will add up. Okay, when we are recording, actually the voltages from one motor unit add up to the voltages of other motor unit. This is not violation of all or none law, it is just recording. Okay, so whatever voltages are recorded, they add up. At a particular point, what will happen as we increase the strength of the stimulus? Now this MUP will reach a maximum. Okay, and now because we are recording lot of motor unit potential, it is known as compound motor unit potential. It is not from a single motor unit, multiple motor units are activated. So I was telling, yes, if we increase the strength of the stimulus, ultimately it reaches a maximum value. CMUP reaches a maximum value, and that strength of stimulus is known as maximal strength of stimulus. And that means that now all the nerve fibers which are there that have been stimulated, right? So this is the strength of the stimulus we have to use for motor nerve conduction velocity. So how do we record? We use a stimulating electrode which is having a cathodal end and an anodal end. Cathode is basically the negative side of the electrode, anode is the positive side of the electrode. Okay. Now cathodal end we keep towards the site of stimulation, because if we want action potential to travel from this side to the muscle, then cathode should be towards the side of the muscle. Okay. Why? Because this cathode is negative, that means it is going to add negative charges here on top of the membrane. That means inside it is depolarizing. Okay. What is depolarization? That means inside becoming positive with respect to outside, right? RMP is negative inside. So when we add more negative charges outside the nerve membrane, inside is relatively becoming more positive. And when this potential change reaches the threshold, then the action potential will be generated. Okay. So remember, this is important. Cathode is kept distally towards the side of the skeletal muscle, right? Now, the voltage used is suprathreshold stimulus. Actually, it is supramaximal stimulus. Okay, and it is approximately 24% greater than voltage which is required for highest amplitude CMAP. So we use that voltage, stimulate the nerve, and we record the CMAP when all motor units are recruited. And one more thing, that the stimulus which you use is a step stimulus. That means it should suddenly rise, and the duration is only approximately 0.2 millisecond duration. That means when we are increasing the strength of the stimulus, it should be by increasing the voltage strength, not by changing the duration. See, in a strength duration video I have taught that charge is equal to the current, okay, and into the time. Okay, so what I am telling here is that ultimately we have to increase the charge deposition, negative charge deposition on the membrane. So for that, we can do either by increasing the time, or we can do either by increasing the current strength. So what I am telling here, that we do not change the stimulus time, duration we do not change. Instead, we increase the voltage strength for increasing the strength of the stimulus. This is because if voltage duration is increased, it is seen that instead of being stimulated at the site of stimulation, this nerve also gets stimulated at proximal sites. So that becomes wrong. Basically, we want the distance also, the site of stimulation to the site of recording. We will see later that we want that distance also. So wherever we are stimulating, it should be stimulated there only. It should not get stimulated somewhere else as well. Okay, so simple precaution. Now, moving on to the actual procedure. So when we are recording motor nerve conduction velocity, we need to stimulate at two different sites. Okay, so here is an example of medial nerve recording. First of all, we should know the landmarks. Okay, that I am not going to discuss in this video, because that is very practical aspects. Only when you will do, you will understand. Okay, so we should know the landmarks where the nerve has to be stimulated. So here we are stimulating median nerve at elbow and at wrist. So what we do, first we stimulate the elbow, that is the proximal site of stimulation. Proximal is near the body, so proximal site of stimulation, and then we record the CMAP. Okay, so for CMAP recording, that is the recording of electrical activity of the muscle, again we have put some electrodes, and for median nerve we put the electrodes on the muscle of the thumb, that is abductor pollicis brevis. Okay, so we have recording electrode, we have a reference electrode, and we have a ground electrode. So we get one CMAP recording. Okay, now the time taken from the time of the stimulation, this is the stimulus artifact, the time taken from the time of the stimulation to the start of the recording. Okay, the time this takes off, the CMAP takes off, that is known as proximal latency, right? Then we stimulate distally, and then again same thing we do. Okay, so this is the time for the takeoff of CMAP, and this is the point of stimulation. We take the duration between these two, that is known as distal latency. Now, why are we doing that? Why are we recording from two different sides? That is because when the action potential is traveling from the neuron to the muscle, actually there is a neuromuscular junction also. Okay, neuromuscular junction. So in this time, we also have time for neuromuscular transmission. So that is not correct. We cannot include that time when we are talking about time for the conduction of nerve impulse on the neuron. We are not bothered about neuromuscular transmission in this case. Okay. So we have to subtract it from our recording. Okay. So that is why we stimulate at two different points. Determine the proximal latency, that is time 1, and also determine the distal latency, that is time 2. Now, we use one formula, that is nerve conduction velocity is equal to proximal latency minus distal latency, which will give us the nerve conduction velocity in meter per second. So, what is this D? D is the distance between the proximal and the distal stimulating site. So, we measure that distance by a measuring tape. We put it as distance, and we subtract proximal latency with the distal latency. So, we will get the time for the conduction of the action potential between these two stimulating sites. Okay, and velocity is distance upon time. So we get the motor nerve conduction velocity, right? Now there are certain factors which affect this motor nerve conduction velocities. What are these factors? One, whether the neuron is myelinated or unmyelinated. If the neuron is unmyelinated, the nerve conduction velocity is proportional to square root of the diameter of the neuron. Okay. On the other hand, if the neuron is myelinated, then the nerve conduction velocity is proportional to 6 times the diameter of the neuron. Okay, so we know that the myelination increases the speed of conduction of the nerve impulse. So that's what we are seeing, that with myelination, the speed of conduction of the nerve impulse is 6 times the diameter of the neuron. Then we have the diameter of the neuron. Yes, larger the diameter, larger is the speed of the conduction. Then we have temperature. Temperature, with increase in temperature, there is increase in the nerve conduction velocity. Why? Because of the Brownian motion of the molecules. They will move with more speed. Okay. Now, the normal values of nerve conduction velocity which we consider basically are taken at a skin temperature of 34 degrees Celsius and a core temperature of 37 degrees Celsius. Okay, skin temperature of 34 degrees Celsius and core temperature of 37 degrees Celsius. If there are changes in the skin temperature, so for recording we have to make sure that the temperature of the room is maintained in a particular range, right? It is not very hot there or not very cold. So if there is changes in the skin temperature, then we have to add some correction value. For example, for each degree below 34 degrees Celsius, if it is falling, say suppose it is becoming 33 degrees Celsius skin temperature, then we have to add 5% to conduction velocity, right? So that is one mechanism. Other mechanism is that we measure the skin temperature, and if it is lesser, then we have to do skin warming. Okay, so these are the mechanisms for correcting the recorded motor nerve conduction velocity. Then age. In newborn, this nerve conduction velocity, motor nerve conduction velocity is half of that of the adults. At 3 years of age, it becomes same as that of the adults, and again after 60 years, it starts falling. Okay, then length of the neurons is also important. Length of the neurons in upper limbs, the motor nerve conduction velocity is more compared to that of the lower limbs, because length of the neuron also adds to the resistance. Okay, more the length of the neurons, more is the resistance. Now, when we are recording motor nerve conduction velocity, we also have to note the characteristic of the compound motor unit action potential response. We have to look for its amplitude and we have to look for its duration. So, what are the factors which affect the amplitude of the CMAP response? CMAP is what? We said that it is combination of motor unit action potential. So, more motor units activated, say suppose whole muscle is activated, that's what we are doing in motor nerve conduction velocity, then CMAP response is more, amplitude is more. Understanding why we are saying that? Sometimes if there is muscle injury, there is loss of the muscle fibers itself, okay, or there is a loss of the neurons which is supplying the muscle, then those muscle fibers will not be activated, so amplitude is going to decrease, right? Then duration of the CMAP response also, what are the factors which affect? See, we are telling that CMAP response is summing up of the action potentials. So say suppose this is one motor unit action potential and this is the second motor unit action potential, and if we see the duration even after summing up, what will happen? Amplitude is going to increase but the duration is going to remain the same, because this will add up, right? And they will add on the same time because they are being stimulated together. Now, suppose the conduction velocity in some neurons is lesser compared to that of the conduction velocity in other neurons. So, what will happen? In one muscle, CMAP will come faster because by that time action potential has reached to that particular muscle, and in other muscle, it will be slower. Okay, it will come later. So, now if this adds up, what will happen? The amplitude is going to decrease, okay, and somewhat such kind of CMAP response we will get, okay. They will be adding up, right? And you see what has happened? The duration has increased, right? So that's why we should know the amplitude and duration of CMAP as well to interpret the presence or absence of any disease. So what are the normal values? In upper limb, if we talk about the motor nerve conduction velocity, median nerve and ulnar nerve, motor nerve conduction velocity is greater than 50 meters per second. And in lower limbs, commonly recorded are tibial nerve and sural nerve. And as I told that the length of the neurons affects the motor nerve conduction velocity. So you see, motor nerve conduction velocity in these nerves is lower. It is greater than 40 meter per second. Okay, because these are lower limb nerves, they all start from spinal cord, so they are long nerves. Okay. Now moving on to the interpretation of the values which we have obtained. Okay, so what we did, we recorded the proximal latency, the distal latency, we determined the nerve conduction velocity, then we have the CMAP amplitude and CMAP duration. Okay, now if it is a demyelinating neuropathy which is uniform in nature, okay, that means it has affected all the neurons uniformly and it is demyelinating, that means the myelin is damaged, then the proximal latency is going to increase because it is traveling slowly. Distal latency also going to increase because again demyelination, it will travel slowly, the action potential will travel slowly. Nerve conduction velocity is going to decrease, okay, because this time is going to increase, total time is going to increase. We have seen the formula for nerve conduction velocity is this, right? So because all this time has increased, so ultimately the denominator is increasing, velocity is going to decrease, right? And because it is affecting uniformly, CMAP duration is not going to be changed. Okay, understanding, all the motor units will be stimulated at the same time because all the motor neurons have been affected uniformly. Okay, CMAP amplitude, what will be the effect? There will be no effect. Why? Because the action potential will ultimately travel to the motor units, though slowly. Okay, it will ultimately combine. So CMAP amplitude, no effect. Then demyelinating neuropathy, non-uniform. Non-uniform means that now some motor fibers are affected more compared to those of the others. Okay, so in some there will be faster motor nerve conduction velocity, in others there will be slower motor nerve conduction velocity. Okay, so nerve conduction velocity is going to decrease But because it is non-uniform, in some we will have CMAP like this, and in others it will appear late because of slow conduction, right? So if you suppose stimulate proximally, some action potentials will reach fast, some action potential will reach slow to the motor units, okay? So we will have CMAP amplitude which is decreased because it will not sum up simultaneously, right? And CMAP duration, it is going to increase, right? Then there is focal conduction block. So say suppose here somewhere there is a demyelination or some injury is there, so that there is focal conduction block. So the action potential will not travel when you are stimulating proximally, right? So proximal latency is going to increase, but distal latency is going to be normal. So yes, nerve conduction velocity ultimately is going to decrease because one of the time is increasing. So total time, if we calculate from here, it is going to increase. Okay. So nerve conduction velocity is going to decrease, but very important that the proximal latency has increased and the distal latency is normal. What will happen to CMAP amplitude? With proximal stimulation, CMAP amplitude is going to decrease. With distal stimulation, it is going to be normal. Why it is going to decrease with proximal stimulation? Because there is a block, okay, and there may be changes in the way the action potential is traveling. Then moving on to axonal neuropathy. Axonal neuropathy means axon itself is destroyed. There may be normal myelination inside the nerve fiber is getting destroyed. So in this case, nerve conduction velocity is normal. However, the axon is destroyed, so from some nerve fibers, the action potential is not reaching to the muscle. So all the motor units are not getting stimulated. So CMAP amplitude is decreasing. Okay. So all motor units not stimulated, the combination, the adding up of all the voltage is going to be lesser. So that was basic interpretation of motor nerve conduction velocity. Moving on to sensory nerve conduction velocity. Okay, in sensory nerve conduction velocity, as I told you before, we stimulate at a particular point and we have to stimulate distally. Why? Because sensory nerve conduction velocity, the neuron actually arises distally and goes proximally to the spinal cord, right? So here are certain electrodes. So these are the ring electrodes. Now you see cathode is this side, right? Why? Because we want the action potential to travel towards the body. Okay, so cathode is now proximally. So we use a ring electrode for median nerve, right? And that is stimulating the nerve, and then we record the action potential somewhere in between. Okay, so this is orthodromic conduction is recorded. That is the preferred one. Sometimes antidromic conduction can also be recorded. So in that case, we stimulate somewhere here and record either from the wrist side or towards the elbow side. So this is antidromic conduction. Okay, that can also be recorded. Action potential will be recorded, but the preferred is orthodromic conduction. Stimulate with the ring electrodes and record proximally. So here we are recording directly the action potential, because there is no muscle. Okay, so where to record? We have to record directly the action potential, and action potential amplitude which is recorded actually is very less. So we have to do something known as averaging. What is averaging? That means we keep on stimulating one after the other. We are stimulating, okay, once we stimulate, we record the action potential, again we stimulate, second time again we record the action potential. So what happens? The noise which is there, that means unwanted signals which are being recorded, they will cut off, because noise doesn't has a pattern. It will all cut off. Okay, when we sum up the noise, it will become zero. While action potential has a particular pattern, so it keeps on adding up, right? So in comparison to the noise is cutting off, and action potential, it is becoming stronger with each stimulus. Stronger means we are just adding up the voltages. Okay, so that is visible. So this is known as averaging. Then one thing you remember, that for recording sensory nerve conduction velocity, electrode should be on pure sensory portion of the nerve. I told you before, nerve consists of both motor neurons and sensory neurons, and here we want only the stimulation of the sensory neurons. Okay. Then what is the normal value of sensory nerve conduction velocity? Again, in upper limb neurons, it is greater than 50 meters per second. So that was about motor and sensory nerve conduction velocity. Thanks for watching the video. If you liked it, do press the like button, share the video with others, and do subscribe to the channel Physiology Open. Thank you.